Okay, so for the extraocular muscles, I want you to know what they do in terms of like looking up, looking down. So the rectus muscles do exactly what they sound like they do, which is the superior rectus makes you supraduct, which makes you look up. Inferior rectus infraduct, so it helps you look down. The medial rectus helps you look towards your midline, so that's called adduction. And then the lateral rectus helps you look temporally, so to your side. So that's called abduction. The way I remember it is if I tell you to take your arm and add it to your body, you would take your arm and you put it towards your midline. So the word adduction has the word add in it, so that's how I remember that. And then the oblique muscles do the exact opposite of what they sound like they do. So the superior oblique infraducts and the inferior oblique supraducts. And so the thing I want you to remember is like she'll ask questions about patients looking like up and to their left or up and to their right. And so to figure out which muscles are working, you have to know like whether the patient's eyes in abduction or adduction. So rectus muscles work when the patient's in abduction, and oblique muscles work when the patient's in adduction. So if the eye is looking temporally or is like more temporal, then it's using a rectus muscle to look up or down. This is all in terms of like supraduction and infraduction. So if an eye is more temporal, it's using the rectus muscles. If an eye is more like nasal, it's using the oblique muscles. So we'll do a few examples, but I want you to think, so if the question said that the patient's having trouble looking down and to their right, I want you to imagine you are the patient. So I want you to imagine I want you to physically look down and to your right and pay attention to where your eyes are. So my right eye is looking more temporal. So it's more temporal and it's looking down. So it's using a rectus muscle, and to look down, it's using the inferior rectus. The left eye is more nasal, so it's using an oblique muscle, and the oblique muscle that helps you look down is the superior oblique. Another thing you can do to check if you're right is that a superior rectus will never work with a superior oblique, and an inferior rectus will never work with an inferior oblique. So it has to flip. So you'll be using one superior and one inferior muscle. So if we look at this example, this patient is having trouble looking up and to their left. So let's focus on the right eye. The right eye seems like it's doing fine. So the right eye is a little bit more nasal. So it's using an oblique muscle. So it's using the inferior oblique muscle to look up. The left eye is having trouble looking up and to the left. If it was normal, the left eye would be a little bit more temporal. So it'd be using a rectus muscle. So it'd be using the superior rectus to look up and to the left. And so I'd say that this patient has a left supraduction deficit. And it looks like they can't look all the way to their left either with that left eye. So they have a left abduction deficit as well. So if we look at this one, in this example, the patient was told to look straight to their left, and they're unable to. So the right eye is looking more medial, so it's looking more nasal, so it's using the medial rectus. And the left eye was supposed to look laterally, or like temporally, so it's using the lateral rectus. So, but it's unable to do that. So this patient has an abduction deficit. So another thing I want to make a point of is that when two eyes are doing the same thing, that's called a conjunctive movement. So if in this case both eyes are supposed to look to the left, right? The right eye is looking to the left and the left eye is looking to the left. Those are both. This is called a conjunctive movement. The same thing with the example we did before. Both eyes in this example are looking up and to the left. So looking up and to your left is a conjunctive movement. In this case, like if we're performing NPC, the patient is converging. So both eyes are looking medially, so we're using both eyes as medial rectus. But if you think about it, each eye individually, the right eye is looking to the left, and the left eye is looking more to the right. So this is called a disjunctive movement. And the last thing I want to touch on is Herring's and Sherrington's law. So let's talk about Herring's law first. So Herring's law is just saying that if one eye is looking in a particular direction, the opposite eye is getting equal innervation to look in the same direction. So in this case, the patient's looking down and to their right. So the right eye is a little bit more temporal. It's using the inferior rectus to look down, and the left eye is using the superior oblique to look down. So according to Herring's law, these muscles get equal innervation. And another thing is that these muscles are called yoked muscles. So muscles that work together to make the eyes do the same thing are called yoked muscles. And then the last thing I want to touch on is Sherrington's law. So in this case, the patient is supraducting, so it's using its superior rectus. So the superior rectus is being activated. So Sherrington's law is saying that the muscle opposite to the muscle being used is being inhibited. So in this case, the superior rectus is being activated, so the inferior rectus is being equally inhibited. So if we do another example and we say the patient is looking straight to their right, then let's just think about it. So I want you to imagine you're looking straight to your right. You're using your right lateral rectus because your right eye is more temporal. Your left eye is using the left medial rectus because it's looking nasal. So the left medial rectus and the right lateral rectus are yoked muscles in this case, and they're receiving equal innervation because of Herring's law. And because we're using the right lateral rectus, the right medial rectus is being equally inhibited according to Sherrington's law. And the same thing for the left eye. So the left eye's medial rectus is being activated, so the left eye's lateral rectus is being equally disinnervated.